Hello everyone, Macomb County Executive Mark Hackle. I'm here at our Communications Technology Center. This is where we have our EOC, kind of been at full tilt for the last probably 2 weeks now. No question about it, unprecedented times that we're seeing here. My experience in law enforcement, bringing us back to H1N1, some of the stuff we dealt with anthrax, 911 was absolutely incredible. What I kind of find out though is sometimes these challenging times are the things that tend to unite us. There's always going to be a tremendous amount of concerns, and unfortunately sometimes a lot of misinformation. So the question is, where do you get the best information, the best intel? Sometimes through the media outlets and obviously communications such as this. So I want to thank you for joining us so I can give you kind of a few issues that we're seeing that I kind of want to redirect, as well as give you some of the information that we're getting from the experts. And I think that's the most important part of this is as you're listening out there to what's being presented, make sure you're listening to the health officials. They're the ones that truly understand the extent of this particular concern, the problem, what you need to do to keep yourself safe and mitigate the problems that we're seeing, but also how far off we see this as becoming the new normal. And so with that, I just want to touch on a couple of things. 911. This is our communications center. We are getting phone calls from people that deal with this particular virus, this concern that people are having. And they're tying up the 911 for some of the simple questions that could be redirected elsewhere. So I'm going to give you some numbers and some websites to go to as opposed to trying to call 911. And we're also finding a lot of people that are calling because they're trying to get test results. They're calling the health department, they're calling law enforcement agencies. Sometimes they're using some kind of a official capacity that they need these results. How that works is if you are getting tested someplace, that hospital center is where you're being tested at, sends it to the state. The state will take a look at those results and get back with the hospitals. The health departments do not have that information, and we cannot get that information. I can't get that information. A dispatcher from a 911 center cannot possibly get you that information. So it all stems or goes back to the healthcare professionals from the hospitals that are going to be able to properly direct you in getting the information to you. So with that being said, don't tie up 911 and understand that the health professionals will get you the information if you are tested or you have a loved one that happens to be tested. The other thing I want to mention, and I have to do this briefly, is because we are going through the census right now, and it's still extremely important. We got the COVID issue going on, but there's many things that we still got to try to figure out how do we move forward on while we're going through these trying times. If you got it in the mail, send it back. If you got ability to do it online, because what we're trying to do is prevent people from having to come to your door to get that information. So let's lessen the impact of the contacts we're having, even with people that are part of the Census Bureau wanting to come to your door. Fill out that census, and by the way, it is extremely important. When you think about Census 2020, think of it this way. Census 2020 brings back the money. This is going to give us a chance to get money back to Macomb County, in particular for those that are listening in Macomb County, or Wayne County, or obviously Oakland County as well. Any community needs to make sure that they're pushing forward to get people to fill out those forms. So those are the two big issues I wanted to get out there. As we continue to talk about this COVID-19, which is its proper name, I want to remind you of what the healthcare professionals are saying, the most important part of this. Washing your hands for 20 seconds. I know sometimes that can be a difficult challenge, and it's something we're not used to doing. Maybe some of you are, but most of us probably aren't. It is one of the number one pieces of advice that the healthcare professionals are giving us. So follow that advice. The other one is the social distancing. They call it flattening the curve is the actual terminology that they're using. But really what that means or amounts to is keeping a social distance from people. And what they're trying to really emphasize is keeping a social distance away from seniors and the vulnerable population. That is most critical. Many of us are probably going to get this virus or probably come across it. And if you do, it's probably going to have a very minimal impact on many of us. So that's what I'm hearing from the professionals that understand us. But the problem is you may transmit it to somebody who is a senior and or other vulnerable population, people that have healthcare issues. So you need to kind of self-isolate yourself from someone if you feel like you're having this particular onset. And what are the, I guess, if you will, signals or signs that you may have if you're actually coming across, thinking I might have them? What are some of the symptoms? And I had them written down. And I guess this is what some people want to know. Geez, am I coming down with this? Am I sick? Because right now, some people are getting sinus infections. Other people are getting other types of the flu. But when it comes to this COVID-19, what the healthcare professionals are saying, if you're feeling somewhat feverish, that's a sign. If you happen to have a runny nose, if you've got a cough, a soreness in your throat, shortness of breath, nausea, or diarrhea. All of those things contributing together, along with a temperature. You actually take your temperature and you're at 100.4 or greater, that could mean you might possibly have this particular virus. And with that being said, it's time to check with your doctor. I mean, get a hold of your provider and make a determination as to whether or not you should be tested. There are test sites around. They're not at the health department. They're not at law enforcement agencies, the fire departments. The testing centers happen to be at the various hospitals, and they're staging them right now, and I know they do here in Macomb County, and I understand throughout the region, where you can actually drive up. It may take a while for them to actually do the test and take the sample and have you drive off, but they will make a determination if in fact you are sick. The first test to see if it is some type of a, I guess if you will, flu, and then if they realize there might be something more to this, they'll send it off to the state for results. Understand that there is a tremendous backup at the state getting those results back to the hospital. So it will take some time. So in the meantime, self-isolate. I mean, get yourself away from other people. Be very cognizant of that because it does make a difference. We don't want this transmitted. And as the professionals are telling us, we know that's coming. I mean, we really have not seen the full impact of this here in Macomb County. Questions are with the schools. What are we doing with the schools? Are they going to continue to be closed? You know, from what I'm hearing, that could be a very strong likelihood that the schools, I guess, the session for this year is pretty much over. But again, I can't make that decision. That's something that's going to be made by the school officials as well as I believe the governor having to make that determination. We've already seen some challenges. I mean, closing down businesses, non-essential, restaurants, bars. You know what? I tend to believe that even though it's going to be somewhat of a challenge for or an impact on our economy, when it comes to the health and welfare of our society and knowing what's coming, I think it was a good rational decision on behalf of the governor as well as those folks that were getting ahead of this. There's no question. We've got to keep people away from each other, keeping that social distance, and the restaurants and bars are important. But keep in mind, some of them will be open for carry-out or drive-through. That's still allowable, and we hope that you do frequent those restaurants and facilities through carry-out options that they may have. It makes a big difference. In Macomb County, we're staying open as a county. What do I mean by that? Essential versus maybe sometimes what we term as a non-essential. There are functions here that go on within county government that are essential to you as the public. Our roads department, talking about the communications center with 911, public safety in general, the jail, making sure the courts are open, so the wheels of justice. But each and every one of those areas, public works, the health department obviously, every one of those has some kind of a related function that's sometimes integral to trying to make sure that we're getting the service provided to the public that is necessary. And so we've had to do the very same thing. Try to figure out how do we flatten the curve. So we've had to try to figure out, is there other work alternatives for folks? Can we maybe have some people come in on some days as opposed to others? Lessen the social contact or interaction with people in our facilities and even limit people coming into our facilities, trying to make sure that we're providing services that might be online. So check ahead before you actually come to the county for any type of service to make sure that it's available, or maybe there's an alternate availability online for that. We are trying our best that we can, along with other local municipalities, to try to get that information out to the public. But in the meantime, we want to make sure you understand there's a reason why we're scaling back on some of that. And it's, once again, it's all about this flattening the curve and making sure that our folks here working internally are staying healthy as well and not contracting the COVID virus. If it starts to spread throughout our facilities, obviously that presents itself a tremendous concern for all of us here as well. So again, this whole idea of avoiding one another, cutting back on the contacts, we tend to see right now people with this uneasiness and this concern about what's happening, the new normal of sitting around the house and not knowing what to do because the gyms are closed. You can't go many places that you normally did to the movie theater. We understand that. So it's going to be a chance for families once again to unite and get to know each other once again. We're fortunate we're coming upon the spring and summer so we can get outdoors and kind of maybe get a little bit more fresh air. And once again, I think the importance of that is you're no longer in close proximity. All of those things are coming and it's going to be somewhat of a challenge for us. But we don't want people to panic. We don't want people to get overly reactive to this. And I say that for this reason. We see what's going on in the grocery stores right now. People buying out the meat counters, the toilet paper concern that everybody's got. I mean, those are big issues right now. And so with that being said, we need people to just kind of calm down a little bit, making sure that they're being sensible in their reaction to this particular, crisis that we're going through. But as I mentioned before, every time we have had in this country some type of a crisis or some type of a challenge, I tend to find out as we go through that, you'll find who the helpers are, you'll find who the people are that want to help meet that challenge, but there's no question about it. In the end, it tends to unite us. And so with that being said, we hope that you're a part of the solution here and try to figure out how do you keep yourself safe. Follow the expert advice from those that really understand us better than I think most of us people that are just out there in the general public. And if you want more information, please go to MacombGov.org, and you can go ahead and click on the COVID virus icon that we have there. So MacombGov.org. There's an actual icon that says COVID virus. Click on that for a tremendous amount of information, basic information. Otherwise, we have a hotline here. Our health department has a hotline, and it is staffed 7 days a week. And again, it's from 8:30 to 5 o'clock, 7 days a week. And that number is 586-463-3750. Again, that number is 586-463-3750. I want to thank you for helping join us to try to figure out how do we fight this issue in and around our community. But again, let's stay united in this fight. Thanks again. I'm Macomb County Executive Mark Hackle.